This is Awiri Health Center II in Dokolo district. It lacks beds, no maternity ward, and with burdened health workers serving big numbers of patients. The health workers here have expressed concern over the situation, calling on government to elevate the center to Health Center III to allow better services.
If possible, forward the what? Awiri Health Center should be promoted to Health Center III so that they will increase for us the number of the staff. Because these few staff you are seeing, you work day and night. You work now as we have completed our patient. Anybody who is coming, we are at the standby.
Despite such concerns, the Assistant Chief Administrative Officer, Dokolo District, Rebecca Mwima, says the structures at Awiri Center II are mandated as per the Health Act for Health Center IIs and therefore not entitled for certain services like the maternity wards.
In a health center too, they are not supposed to have a maternity ward. But for us as Dokolo District, in trying to solve the distances that our mothers face, we're able to provide a place which can be like a first aid, an area where they should come to save the long distances for those who may not be able to walk up the health center for.
But on the issues of elevating the health center, the district leaders say a proposal has already been submitted to the Ministry of Health, and they are now lobbying the government for support since they are not allowed to add any structures in the health center IIs.
And as a district, we have approved and we have sent it to the ministry to elevate Awiri Health Center II to go to Health Center III. Wow. And Dokolo Health Center IV to go to the levels of the district hospital.
The health center has only 3 health workers, and these are overstretched with the workload and the daily numbers of patients that engage them for 24 hours without rest.
So, according to the standing order, you see that the total number of the patients we are seeing, it is overwhelming. According to Health Center II, the ceiling is supposed to be 3 people. 1 enrolled nurse, 1 midwife, 1 nursing assistant.
We shall sit down and see and continue waiting. If at all they give us a no objection from the ministry, we shall see how to plan to increase and improve health service delivery in order to reduce the workload on them.
The situation is worse when it comes to pregnant mothers, where their conditions may require close attention throughout the night, and yet the medics have to attend to other patients in the OPD section, a situation that has led to the collapse of some of the health workers.
I've ever been collapsing on duty. I've ever been put on drip. Would you expect me to be buried before the day I'm supposed to be buried because of the work?
The health workers also complain of lack of motivation, and yet they are qualified nurses who have worked under harsh conditions for over 10 years and need promotions but have never experienced any. They now prefer early retirement to allow them enjoy another life.
If they cannot promote Awiri Health Center II, we are requesting for the early retirement so that we retire early and we go back home.
There are so many parishes which comes here. So my cry, before even I go outside, I say that please, if there is a difficulty to promote this health center too, please retire these women, let them go back home.
This room is used as the maternity ward and as an OPD as well, but it has only 1 functional bed and the rest are broken. And this is the delivery room with 1 bed, but the midwife here says it is not worth to handle serious cases.
It is even small. Sometimes we have mothers who are even fat. They are not comfortable in this bed, so we are requesting if possible they could give us delivery coach which is large.
The health center lacks equipment like forceps, including those for resuscitating mothers who have lost strength on delivery. Also, there are no trained personnel for option B+, which makes it difficult to make follow-ups on mothers at their homes to monitor the well-being of the babies. Stephen Mwiri, WBS News.